Chronic shoulder pain is incredibly common, and the older you get, the more likely you are to develop some kind of a shoulder problem. And today we're going to talk about 3 most common causes of chronic shoulder pain: rotator cuff tendinopathy, impingement syndrome, and subacromial bursitis. They account for over 60% of chronic shoulder problems, depending on your age. And the treatment is very similar for all 3. We'll do treatment, specifically exercises, injection, and surgery, in a second video of a 2-part series. I am Dr. Shep. I am a doctor of sports and spine medicine. So let's jump right into it. People with chronic shoulder pain typically have pain that doesn't let them sleep at night. Any kind of overhead activity, something like getting something from kitchen cabinets, is painful. Lifting anything overhead is painful. Unhooking a bra is painful. Even something simple like lifting the shoulder can become difficult. And that's when I finally see the people in my office, when it has become absolutely intolerable. By itself, the shoulder is an incredible joint because it has more motion than any other joint in the human body. But the flip side of having so much mobility is it is also vulnerable to injury than any other joint in the body. The shoulder is a ball and socket joint where you have the head of the humerus join the glenoid cavity of the scapula right here. Think of it like a golf ball on a tee. And it also means that it's at risk of sliding off. And when it slides off, this golf ball, we call that a dislocation, which is actually a relatively common event. It happens to about 2 to 3% of the general population. So the shoulder is not a stable joint. So to counter that, your body tries to hold that too with ligaments and muscles that give it stability and mobility. The main ligament is called the capsule, and the main muscle groups are called the rotator cuff muscles. The mnemonic to remember them are called the sits muscle, the supraspinatus up on top, the infraspinatus and teres minor in the back, and subscapularis in the front. So it looks like this. These muscles are relatively small and weak. And so if you overuse them and don't rest them, then the shoulder is at risk of developing inflammation or tendinopathy, which over time, chronic, will develop tears or little openings in these muscles, further weakening the entire shoulder and making it unstable. Now, if you're learning something from this video, please help support this channel so that the YouTube algorithm can upvote it by pressing like and subscribe. It takes a very long time to make each of these videos, so every little helps. Thank you. Now back to the video. This brings us to the first of the 3 chronic shoulder problems, the rotator cuff tendinopathy. This problem refers to the breakdown of the rotator cuff tendons, especially at the point where the muscle attaches to the distal bone, right in here. So this chronic shoulder problem refers to the breakdown of the rotator cuff tendons, especially at the point where the muscles are attaching to the bone. And this is an area that does not have good circulation or blood supply. So it is prone to injury, which the flip side of that also means that it responds well to regenerative injections. So anytime we do PRP or prolotherapy, your own blood injections into this area, it will respond well to. The rotator cuff tendinopathy is usually caused by overuse or advanced age, and the symptoms are the same as for others: pain, weakness, or limited range of movement. Now, number 2, bursitis. In shoulder bursitis, there's a little bursa, a little pocket of fluid-filled sac that's located between the rotator cuff tendons and the acromion, this bone right here. And bursitis happens when this pocket of fluid becomes inflamed or irritated, usually because of overuse, trauma, or just bad shoulder mechanics. Think of activities like swimming, basketball, volleyball, or tennis. And again, the symptoms are the same. The person is complaining of pain, weakness, and limitation in movement. And finally, number 3, impingement syndrome. And here, there's pinching or impingement that happens where the space between the acromion and the tendon narrows, causing the compression of both the tendons and the bursa. So here we have both the rotator cuff tendinopathy and bursitis. So 2 conditions in one. So just to go over this information again, in tendinopathy, the tendon is involved and irritated or torn. In bursitis, it is a fluid-filled sac that's irritated or inflamed. In impingement syndrome, it's both the tendon and the bursa that's involved. So that's why it's so important to understand all 3 of these conditions, because they could exist at exactly the same time and they could cause each other. And that's why you need to have a good doctor to diagnose the problem, because one could lead to the other and could cause the progression of the other. Otherwise, you could start with one problem, let's say bursitis, and progress to have all 3, impingement, bursitis, and a rotator cuff tear if you don't address it in time. So if you like this video and want to learn more, watch this video about the exercises to treat chronic shoulder pain and the injections that heal this problem so that it doesn't come back in the future. So take good care of yourself and always keep learning, and press like and subscribe. Have a great one.